Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do is I just perform cosmetic or aesthetic plastic surgery. A lot of people come into me talking about their face and wanting to have some kind of a consultation or opinion regarding their facial aging. And a common question that I get posed to me either outside the office or in the office during consultations is, Dr. Shapiro, what can I do to maximize the lack of volume and the lack of elasticity in my lower face? First of all, to understand that when people age, it really is a blueprint with regards to what your genetics are like. So it's kind of predetermined how you're going to age, and it depends upon other things like sun exposure, habits in terms of smoking, and how you've taken care of yourself in the past. Basically, when people have lack of elasticity or lack of volume in their lower face, depending upon what you're looking for, there are some things that we can do to alleviate these symptoms and signs without surgery. And the first would be some soft tissue fillers that we do in our skin clinic, something called Juvederm or Restylane, or there's some Sculptra, and that can provide some volume along the lower face to give you that volume that makes you look younger and more voluptuous. Of course, if you put on weight, that will also make you look better with regards to aging, but a lot of people don't want to make that kind of choice. They'd rather be thin and attractive that way and show some of the aging on their face. With regards to the elasticity, short of surgery, there are things that we can do to increase the elasticity of the skin by increasing collagen production, and those can be some laser peels, some chemical peels. There are some non-invasive treatments in the office, something called Ulthera, which is a ultrasound therapy that targets the lower skin and muscle layers to provide some contraction and tightening of those areas. It's best in the lower face and the mid-face. And then there is always some variation of fillers, such as injecting your own fat along areas where you may have lost volume along the jawline and the mid-face. And that has been shown also to increase skin quality. So oftentimes a combination of these minimally invasive or non-invasive treatments can give you what you're looking for. Again, there also are some variations of a full facelift, something called a Gen X lift that is a short scar facelift combined with fat transfer. These are things that can be done in the office. And of course, there are the more aggressive treatments that ultimately give the best results, but that is actually a facelift with fat transfer, and that's usually performed in the operating room. So there's a whole slew of things that we can do for you to increase your volume and increase the elasticity of the lower face and make you feel like you look younger and put that spring back in your step. The best way to figure out what can be done for you is to come in for a consultation. I'll have you meet my office staff in terms of the estheticians, my nurses that do injections for soft tissue fillers and do a lot of these minimally invasive treatments. And of course, I'll talk to you about what can be done surgically. Thank you very much.